Hello, I'm Captain Jeffrey Nemhauser, a medical toxicologist with the Centers for Disease Control and Prevention. Townsend State University is located in a city with a population of about 600,000. Our story begins on a September Saturday as 87,000 enthusiastic fans filled the university stadium for the season's first home football game. During the halftime show, a high-powered explosive device detonates near the stadium's south entrance. Police immediately evacuate people from the detonation site as first responders provide emergency medical treatment. An assessment of the detonation site reveals elevated levels of radiation, indicating the presence of a radiological dispersal device. Rumors spread that an unknown terrorist group is responsible for the explosion. The health department quickly establishes a community reception center at the local high school to assist people who were contaminated or thought they were contaminated with radioactive material. The health department also begins to staff hotlines to address questions from the public and healthcare providers. Public service announcements on television and radio encourage people who are not injured but still feel they need help to come to the center rather than to already overcrowded emergency departments. EMS transports injured persons to the local hospital. The following scenes take place at various response locations: the Public Health Department call center, the Community Reception Center, and the hospital. Our first scenario takes place at the Health Department call center following the explosion. The hotline number has been broadcast through local media and has been given to persons leaving the Community Reception Center and the hospital. As you watch the scenario, notice how the responder uses principles of psychological first aid to promote safety, calm, connectedness, self-efficacy, and help.
Public Health Hotline, this is Carol. How can I help you?
Yeah, I want to know what's going on.
May I ask your name?
It's Rick. Can you tell me what's going on here?
Well, Rick, my name is Carol, and I want to help answer your questions. How can I assist you?
Do you people know anything? I don't think you really know what's going on. I'm getting bogus information.
Rick, I want to help you. What have you been hearing?
The stadium blew up, and the crap got all over everything and everybody. I don't want that crap on me.
That's understandable. The explosion at the stadium is devastating. Most people don't know anything about radioactive material. Were you at the game?
No. I was with friends at home. We were watching the game, and then we saw it happen on TV. Man, people were screaming and running everywhere.
Yeah, it was scary to watch. How far do you live from the stadium?
About 7 miles. But I work at Joe's Bar and Grill nearby.
Well, Rick, since you weren't at the game, how do you think the radioactive material got on you?
My friend Bob was at the game, and he got it on him. And he had to strip down and shower and get other clothes. And then he came back to work where I was, and we were touching the same stuff, and I don't want to get that crap on me.
Okay, so Rick, you think that by being around Bob and by touching the same things that Bob touched, that you could get radioactive material on you?
Yeah.
Okay, well, I can see how you'd be concerned. It would be scary to think that that could happen, but I want to give you some information that can help, okay? Think of radioactive material as mud. Once you wash it off, it's gone. So, Rick, did you say that Bob had a shower and put new clothes on?
Yeah, he had to take off everything, and they gave him different clothes.
Right. Well, they did that to make sure that he was clean, that he didn't have any more radioactive material on him. So, that means when he came back to work, there was no way any radioactive material could get on you.
You mean I can't get anything from him? I'm not crazy for worrying about this.
That's right. You cannot get any radioactive material on you, and you're not crazy.
That's a relief. I thought I was going nuts.
Rick, this is a tragic event. Have you been able to talk with any family and friends about what happened?
No, not really. I have family out of town, and friends have been calling. I haven't called them back. I have too much on my mind.
Yeah, that's understandable. Well, look, maybe when you're ready, you can call some of your family and friends, and you can talk to them a little bit about what's been going on.
Okay. That's a good idea.
Well, Rick, do you have any other concerns or questions?
Did we catch the people that did this to us?
No, the suspects have not been found, but the local and state police are on the case. Now they have the FBI involved, and very soon we're going to find who was responsible for this. Well, Rick, if you don't have any other questions, I'd like to ask you a couple.
Yeah, sure.
What have you been doing to deal with the stress?
Well, I've been glued to the TV watching the latest news on the bombing, and honestly, I've been drinking some.
Rick, we found that spending time with family and friends really helps reduce stress. Drinking alcohol and constantly watching the news coverage does not.
I hear you.
I just want to leave you with a couple of thoughts. I will be here from 10 to 6 for a week. Please feel free to call me if you should have any questions. You can also go to our website if you want to learn more about radioactive material.
Thanks. I appreciate it.
Well, whenever you call, someone will be at that number. We have some good people here to talk with you. Remember that none of us are experts on how to handle a shock like this. Sometimes it's helpful just to bounce your thoughts off someone else who's had the training in the subject.
You know, it's really been good talking with you. You've been helpful.
Well, no problem. You just keep taking care of yourself, okay? You can call us if you have any questions.
Thanks.
Okay. Bye-bye.
The following scenario takes place at the Community Reception Center. When the explosion occurred, Mary Smith, a single mother of 2, was walking in her neighborhood near the campus. Her children were on the TSU campus attending a weekend science camp.
I need to tell people what's going on.
Mary has been advised to report to the Community Reception Center at the local high school and has been informed that her children will be brought there as well. As you watch the scenario, pay attention to how everyone at the Community Reception Center uses psychological first aid.
Hello, ma'am. My name is Joe. I work with the health department. May I ask your name?
It's Mary.
Mary, are you feeling okay?
I'm not hurt. I'm just really worried. My kids were at the TSU science camp. Do you know where they are? Because I was told they were here.
Mary, I understand your concern about your children. I've gotten reports that emergency medical services are there, and they're trying to get everyone on the bus who was on campus and bring them here.
What is this reception center? What's going to happen to me?
Well, we have devices here to detect radiation. If you have any radioactive material on you, we will clean it off. Now, Mary, have you had a shower or changed clothes?
No, I've been looking for my kids. Somebody told me that they were here.
Well, if I find out anything further about your kids, I will let you know. So, Mary, if you can just go through the doors to the line inside, we'll get you checked out.
Thanks.
Thank you, Mary. Next.
Where can we get in?
Could you step forward, please? Thank you. If you could stop right here. You may proceed on. Thank you. Hi, ma'am. If you could just step forward, please. Thank you. And just stop right about here, please. Ma'am, could I ask you to step back, please?
What's happening? Why is that beeping? What's wrong with me?
Well, ma'am, our monitor has indicated you have some contamination that needs to be removed. If you could go with Susan, she'll walk you over to the wash station and explain what to do.
Are you serious?
Hello, my name's Susan, and I'm a volunteer with the health department. What's your name?
It's Mary. What's going on? Am I going to be sick?
I want to explain what's going to happen next and answer all of your questions. Your concern is perfectly understandable. The monitor has indicated that you have some contamination on you, so we're going over to the wash station where you'll be asked to shower.
What? Why?
Well, think of radiation contamination as if it were mud. You can wash off the contamination with soap and water just as you can wash off mud. In case any of the contamination got on your clothes, we'll give you some clean clothes to put on, and then we'll check you again for contamination.
Well, what about my handbag? Because all my kids' information is in here.
You may keep your handbag, and we'll give you a moist wipe to clean it off.
Okay.
Are you from around here, Mary?
Communicating instructions clearly and calmly is an important part of psychological first aid. When using unfamiliar equipment, such as radiation survey instruments, explaining what the equipment does and why it is being used can help provide the public with a level of comfort. If you are wearing personal protective equipment, such as a mask, communicating with people can be difficult. Remember to speak slowly in simple, concrete terms and be ready to repeat and clarify information as many times as is necessary. address people directly. By showing interest and calm concern, you will be most helpful to people who may be feeling overwhelmed. To help orient people to disaster response activities, provide information about what is being done, what is known about the event, what services are available to help, and what they should expect may happen next.
That looks very good. And if you'll just step through that door right over there, okay? Hello, my name is Bob. Now what I'm going to do with this device is I'm going to scan you for any radioactive material. We will make sure there's no contamination left on you, okay?
Okay.
Okay, would you put your purse down, please? Well, it looks like you got all the contamination off at the wash station.
Well, that's some good news.
What I'm going to ask you to do now is step over to the registration area. Now, the folks there will collect some information from you, just in case we want to get in touch with you later, okay?
Okay. When I get to see my kids, is it okay if I hug them? I mean, am I going to make them sick?
Well, I can understand your concerns, and it would be very scary to think that you would make your children sick. Well, let me explain to you what's going on, all right? When you went through the monitor the first time, it indicated you had some level of contamination. So we had you shower and change clothes at the wash station. Now, this monitor clearly indicates you're no longer contaminated. You cannot contaminate anybody. So, if you want to give your kids a great big hug, that'd be fine. Only after they've been checked out, okay?
All right. Well, that's a relief. Do you know when they're going to get here? Because they were on the campus.
That I do not know. But I do know the people in the registration area are staying in constant contact with the local responders. And hopefully they'll have some information for you, okay?
Okay.
All right, you just go right through the door.
Okay.
All right. Right through there.
Hello, ma'am. Have a seat. My name is Tony. We're collecting some contact information in case we need to get in touch with you later on. Could I please get you to complete this form?
I can't believe you're asking me to fill out all this paperwork now. I can barely think. Where are my children? I demand to know now.
Ma'am, I understand that you're upset.
I want to see your supervisor. I'm not filling out anything until I see my children. I got stripped down, showered, put into these awful things, and now you want me to fill out forms?
Well, I know this is a scary situation, and I know that you're worried about your kids. Were they at the game?
No, they were at the science camp, and I keep asking people, when are they going to get here, and nobody will answer me.
Well, we got a report from the first responders that the buses carrying the kids from the science camp have left the college, and they're on the way here.
Well, how long until they get here?
We anticipate their arrival in about 35 minutes, but it could take a little bit longer. The roads are busy and there's a lot of debris.
Are they okay?
They wouldn't be brought here if they were injured. The camp counselors are with them now and are going to remain with them as they go through the reception center. Now, if you choose, you can wait in the family reunification area.
Do I have to?
No, if you'd like, you can exit the reception center and meet your kids and go back through with them. But if you do choose to go back through, you may risk some additional contamination. It's your choice.
I'm not sure that I understand what you're saying. What's going to happen to my children? Where are they going to go?
They're going to go through exactly the same process that you went through. We want to make sure if they have any radioactive material on them that we get it off. Now, is there anything I can do to make this a little bit easier for you so you can complete this form for me?
No, thanks. I'm sorry that I yelled. It's just with the explosion and my kids were so close, and this is very overwhelming.
Well, having emotions and reactions are perfectly normal, especially since you're not with your kids right now. Now, when you leave here, we're going to give you a brochure. It's going to have some information about radiation. It's going to have a contact number for the health department. And you can contact that number anytime between 7 a.m. and 7 p.m. And they'll be able to answer all the questions that you may have.
All right, here's your form.
Thank you.
Is it all right if I go over there and call my sister and let her know I'm okay?
Oh, absolutely. You should contact friends and family for support. And I'll be sure to let you know when your kids arrive.
Okay.
And if you have any needs or any questions, just ask any staff member at the family reunification area, okay?
Okay, thanks.
Okay.
Notice that none of the reception center workers made promises to Mary that they would be unable to keep. Notice, too, that the workers used nonverbal strategies to communicate calm. Workers kept open postures, kept their arms and legs uncrossed, and they leaned forward, maintaining eye contact with Mary. Workers were attentive to what Mary was saying and answered her questions before delivering the information they needed to communicate. If you have mental health professionals available to work within the Community Reception Center, consider placing them strategically throughout the center. However, everyone working in the Community Reception Center should have some training in psychological first aid. The following scenario, which takes place at the local hospital, is taken from the Centers for Disease Control and Prevention's just-in-time training video for hospital clinicians. It illustrates the importance of dealing with psychological needs as well as medical needs. Remember that life-saving care takes priority over treatment of any radiation exposure or contamination.
Help me, I'm covered in radiation! Someone help me, please!
Okay, calm down. You're going to be all right, but we have to help you, so you have to calm down first so we can help. Come with me. We need to wash this dust off, okay? Come on. Are you hurting anywhere?
No, I was inside during the explosion, but afterwards I came out and I walked through this cloud of dust.
Okay.
Everybody's saying that it's radiation. Look, I've been breathing this stuff in.
Okay.
Look, please help me. I'm really scared.
We will. We're going to get the contamination off and you'll be fine.
Okay.
Okay?
Okay, sir. Please put your valuables in this red bag. Then take this white gown and put it over your clothes. I'm going to have you undress underneath the gown and put your clothes in this orange bag. Then you're going to go through the shower. I want you to scrub well, especially where you had no clothes covering your body. Someone will help you on the other side.
Okay, okay.
Are you okay, sir?
I'm worried. Look, there's radiation in this stuff, isn't there?
You're going to be all right. I know this is very upsetting. We need for you to walk over to our staff member over here. They're going to survey your body and make sure the contamination is gone. Then they're going to take you to another area where other staff members will talk to you about all of this and about radiation.
Note that even in the stressful atmosphere, the hospital staff remained calm and communicated calmly to the patient. This can go a long way in helping diffuse a stressful situation. Managing emotions in a disaster can be difficult, but respectful and calm treatment gives people a sense of dignity and self-efficacy. The staff also actively engaged with the patient and used task-oriented language to explain what was happening. Remember that staff may also have questions that require a degree of psychological first aid.